I'd like to welcome everyone to our first BSG Online Flagship Symposium, which involves 3 presentations of recent research studies looking at what the dementia-friendly community means in practice. Here in the UK, dementia policy for the last 10 years has emphasised the ideal of creating dementia-friendly communities in which people living with dementia remain actively involved in everyday community life and are able to maintain their social networks and have a sense of continued belonging. But this is in many ways a tricky concept. What, for instance, constitutes a community? And what would it mean for such a community to be dementia friendly? Indeed, both these thoughts come on, the notion of community has come under increasing scrutiny as a result of the pandemic, with lockdowns threatening everyday life for us all, but especially impacting on people with living with dementia and their families, as Steve was commenting. Moving out of lockdown, as we're hoping to do in the UK, invites us all to focus on translating these ideals then into practice. So we thought an international perspective might be especially helpful in terms of understanding these issues and throwing light on them. The structure of today is that what we're going to do now is we're going to hear short presentations on these 3 studies, and those presentations have been pre-recorded. And we'll then have time for a short plenary session at the end of that, which will be live, and we'll bring in colleagues Hayley and Charlotte will cue then in the rest, the speakers themselves around the globe. And we would invite you to use the facilities of this application to send in any questions that you might have, and I'll try to put those back to the speakers. So just to introduce them very briefly, Dr. Stephanie Buckner is a researcher at the University of Cambridge. She has an interest in age-friendly and dementia-friendly communities, and until recently she worked on the National Evaluation of Dementia-Friendly Communities, or DEMCOM study in England, and which she's going to present on today. We'll then hear from Dr. Sabrina Luck, who's Assistant Professor in Public Policy and Global Affairs at the Nanyang Technological University in Singapore. Sabrina holds a PhD in Political Science and International Studies from the University of Birmingham, and her wide-ranging research focuses on healthy aging, health financing reforms, smart cities, and public policy analysis. She's the author of a recent monograph entitled Aging, Long-Term Care Insurance and Healthcare Finance in Asia. Marjolein Thijssen is a PhD candidate at Radboud University Medical Center in Nijmegen in the Netherlands. The mentality study that she's going to be talking about is led by Professor Maud Graf and is funded by the Dutch Delta Plan for Dementia, and includes a UK-based advisory group at the School of Medicine at the University of Nottingham, of which Dr. Neil Chadbourne is a member, and Marjolein and Neil will be jointly presenting on that. So I'd now like to pass over to the conference team to play these presentations, and we'll return at the end of them for the plenary session. Thank you very much. Hayley, lovely.
I'm going to present key findings and outputs from the National Evaluation of Dementia-Friendly Communities in England. The DEMCOM study was a collaboration of the Universities of Hertfordshire, East Anglia and Cambridge. Dementia-friendly communities come in different shapes and sizes. They have a common goal, ensuring that people affected by dementia, by which we mean people living with dementia and also their carers or supporters, can continue to be active and valued citizens. Dementia-friendly communities are not necessarily geographical communities. There are also communities of interest such as churches and shopping centres. Dementia-friendly communities have had national policy endorsement through 2 Prime Minister's challenges on dementia in 2012 and 15. An official recognition process for DFCs is in place, provided by the Alzheimer's Society. Our research questions were: what are the characteristics and areas of focus of DFCs in England? How do different types of DFCs enable people affected by dementia to live well? What is needed to sustain DFCs? What value do they generate? And how can we assess DFCs? The study consisted of 3 phases. Phase 1 was the national overview of DFCs in England. In phase 2, we pilot tested a pre-existing evaluation framework in 2 DFCs. In phase 3, we applied the evolving evaluation framework in 6 case study DFCs. In phase 1, we mapped geographically defined DFCs against areas of clinical commissioning groups. We examined whether the presence of a dementia-friendly community was associated with dementia presence in the CCGs. We found that there was extensive national coverage of dementia-friendly communities. Over half of the CCGs had at least one dementia-friendly community. Presence of a dementia-friendly community was significantly associated with number of known and estimated dementia cases, but not with dementia prevalence. We concluded that DFC provision is consistent with epidemiological need and that DFCs are located in areas where they can have greatest impact. We then identified a total of 284 DFCs in England. We selected a diverse sample of 100 of them and examined them through online searches and phone calls. We found that the availability of online information varied hugely across DFCs, and it was often unclear if information was up to date. This has implications for the visibility and accessibility of DFCs. 89 DFCs had started operating after policy endorsement of dementia-friendly communities in 2012, so this was a possible catalyst. Many DFCs focused on raising awareness of dementia, and DFCs were highly diverse in terms of type, size, reach, focus, resourcing, and ways of working. In phase 2, we started with a pre-existing evaluation framework that had originally been developed for age-friendly cities and had then been adapted to dementia-friendly communities. It consisted of 10 so-called domains. These were areas in which we needed to collect evidence to evaluate the DFC. We piloted this framework in 2 DFCs where we collected evidence through interviews, focus group, and documentary analysis. We also presented the framework and the findings from the piloting at a national stakeholder workshop with dementia professionals, researchers, and people affected by dementia. The piloting, the workshop discussions, and also our later work in phase 3 helped us to arrive at a revised evaluation framework for DFCs as a key output from the study. In phase 3, we applied the evaluation framework in 6 diverse case study DFCs, which included the 2 pilot sites. I have summarized some of our findings, but unfortunately we can't look at this in detail here. But just to give an example, we found that aligning dementia-friendly community work with local government initiatives created opportunities to embed dementia-enabling work into existing services. And some dementia-friendly communities were proactive in seeking out people affected by dementia to become involved in their work. We then adopted an economic perspective. We identified the input of financial, human, and other resources into the case study DFCs. Voluntary and public sector funding and donations played important roles, as did the contributions of volunteers. We then used social return on investment methodology and created scenarios where we calculated the value generated by DFCs. For example, a grocery store in a DFC might train staff as dementia friends to retain or attract people affected by dementia as customers. This comes at a cost to the store. At the same time, it generates economic value to the store in the form of profits. In addition, it creates social value for people affected by dementia, for example, feeling of being included. In the approach we've used, there are ways of expressing this as a monetary value. The dementia-friendly communities are assumed to have a high social return on investment. Our findings suggest that this is indeed the case. However, our assessment was limited by the limited data that were available to us, both on the resource input into DFCs and on the impact of the work of DFCs. Based on our findings, we formulated 6 if-then statements to illustrate how dementia-friendly communities can achieve particular outcomes. They highlight, for example, that long-standing local collaboration on dementia can provide an important basis for achieving dementia-friendly goals, and and that supporting active involvement of people affected by dementia in a DFC can do much to ensure that services routinely accommodate their priorities and needs. Dementia-friendly communities operate in different contexts and they are at different stages of development. This shapes what they can achieve. The if-then statements that I've just presented illustrate our theory of change, which we have formulated on the basis of our findings and the wider literature. Its purpose is to show what outcomes DFCs might achieve at what stage of their development. Key outputs from DEMCOM are three components that work together in assessing and guiding the work of dementia-friendly communities. I have shown the evaluation framework and the theory of change. In addition, we have developed a practical guide. The guide lists questions we can ask to assess what a dementia-friendly community has achieved at different stages of its development and to guide its further development. Because of the level of detail, I'm not able to present this here. DEMCOM has arrived at a few key messages. There has been widespread emergence of DFCs across England, supported by policy endorsement and an official recognition process. There is no one particular model of DFC that is likely to deliver the goals of inclusion and participation of people affected by dementia. DFCs are context sensitive. However, there are key features that are more likely than others to achieve reach, impact, and sustainability. Optimal conditions include clarity of a DFC's purpose across its constituent organizations, strong networks of influence, robust working arrangements with statutory services, and involving people affected by dementia as active partners. While DFCs have been promoted as a potentially cost-effective model, there is a lack of routinely available data to test this. DEMCOM has resulted in outputs that can support efforts to assess the work of DFCs and guide them in their further development. Thank you very much.
Hi, and welcome to today's presentation, Building Dementia-Friendly Communities in Singapore. I'm Sabrina Look from Nanyang Technological University. In this presentation, I'll talk about dementia in Singapore, Singapore's dementia-friendly community model, its first national survey on dementia, and critical factors to the development of DFCs. Singapore's population is the second fastest aging population after Republic of Korea, according to United Nations figures. By 2025, Singapore will become a super-aged society with 21% of its citizen population aged 65 years and above. One of the biggest challenges associated with the aging population is dementia, which is a syndrome characterized by deterioration in memory, thinking, behavior, and the ability to perform everyday activities. In Singapore, 1 in every 10 people aged 60 and above has dementia. These correspond to approximately 82,000 people with dementia in 2018 and is projected to increase to 130,000 by 2030. A study found that the total cost of dementia in Singapore was estimated at $1.4 billion per year, and the annual cost of dementia per person in 2013 was estimated at $10,245. These figures are likely to increase as the number of people with dementia increases, which may enormously affect healthcare and social service systems. Many studies indicated that people with dementia and their carers experience greater social isolation and loneliness because of stigma and inadequate support. Efforts to build dementia-friendly communities have been ongoing for some time in different countries, driven by the desire to assist people with dementia to remain independent and engaged in their communities and achieve the best quality of life for as long as possible. According to Alzheimer's Disease International, a DFC is a place where people with dementia and their carers are empowered, supported, and included in society, understand their rights, and recognize their full potential. Communities working to become dementia-friendly should focus on 10 key areas, such as involvement of people with dementia, build understanding, and easy-to-navigate environments. There is no one-size-fits-all approach to the creation of DFC due to political, economic, social, and cultural differences across countries. But central to the creation of DFC is emphasizing social dimension of dementia over the medical, dismantling stigma and improving social inclusion for people with dementia. In Singapore, the first DFC was created in Yishun in 2016 under the Forget Us Not initiative launched by Khoo Teck Puat Hospital and the Nien Foundation. Yishun was chosen to test out the concept of a DFC because of two main reasons. First, it has a significant number of elderly residents. About 10% of residents in Yishun were aged 65 and above. Second, it has a geriatric center to support the creation of a DFC. What started as a ground-up movement in Yishun has spread to other parts of Singapore. At present, there are 8 DFCs in the nation. The DFC model in Singapore is made up of 4 key components, including dementia awareness, go-to-ponds, technology, and infrastructure. The stigma associated with dementia prevents people with dementia from reviewing their diagnosis and getting the help they need. To dismantle stigma, it's important to increase public awareness and understanding of dementia so that people with dementia and their carers feel better supported and live with respect. Greater awareness can be achieved through training. Agencies offering dementia training include Agency for Integrated Care, Nien Foundation, and Alzheimer's Disease Association. There is a 1-hour training section for anyone who is interested in knowing more about dementia. The training focuses on recognizing signs and symptoms of dementia and ways to interact with people with dementia. For example, trainees learn how to use the kind gesture and the care approach to communicate the feelings and thoughts more effectively with people with dementia. Customized training sections that involve participatory activities such as role-playing are also offered to frontline staff, service organizations, and grassroots leaders. Training can be effective in improving their knowledge, skills, and attitudes when serving people with dementia and their carers. For example, public transport service ambassadors were trained to better identify and help people with dementia in the midst of a chaotic peak-hour crowd. All customer-facing staff from DBS and POSB banks were trained to recognize signs of dementia in customers, such as memory loss or repeated cash withdrawals, in order to better safeguard their finances and prevent potential financial abuse. Greater awareness can also be achieved through undergoing the Dementia Simulation. Participants were asked to perform daily tasks like buttoning a shirt after they were outfitted with goggles and gloves to simulate visual and sensory impairment experienced by people with dementia. This simulation helps cultivate empathy and compassion towards people with dementia. Other events and activities to raise public awareness of dementia include having Dementia Care Forum, Dementia Care Exhibition, roadshows, educational booths, and annual events such as Enabling Festival. Another key component of DFC is Dementia Go-To-Ponds. They serve as resource centers to link those who need help with the relevant dementia-related services, such as dementia-specific training for maids and carers, and safe return ponds to help people with dementia reunite with their carers. A website is available for people to enter their current locations to find the nearest GTPs. Community clubs, senior activity centers, and nursing homes are dementia GTPs. In 2017, a nursing home in Yishun became the first 24/7 GTP. It is equipped with a nursing team of 108 who are trained to calm people with dementia down and help them identify and contact the next of kin. As the people with dementia wait to be reunited with their carer, the nursing team can attend to their immediate needs, such as food or a bed to rest on. The third key component of DFC is technology. In 2018, the Dementia Friends app was launched as a one-stop platform to provide users with timely access to dementia care information, tips, and resources. In addition, it notifies users of upcoming events such as training, workshops, and talks. The app also serves as an additional platform for caregivers to ask for help should their loved one go missing. It allows caregivers of a missing person with dementia to send an alert with the missing person's recent photos, personal particulars, and the last seen location. Other app users would receive alerts to help keep a lookout for the missing person. They can report sightings of the missing person through the app, alert the caregiver if they find the missing person, or accompany the missing person to designated GTP. Over 200 people who were reported missing have been assisted so far, thanks to the app. Finally, the physical environment is enhanced to make it accessible and safe for people with dementia. Examples include converting steps to small ramps, railing installations, and clearer signage with larger texts. A dementia-friendly project will be carried out in a district where housing blocks in high-traffic areas will get fresh coats of paint in red, green, and blue, feature icons and large block numbers. These can provide easy navigation for people with dementia and enable them to access, comprehend, and utilize their surroundings more easily. Dementia is a challenging condition. Unremitting efforts have been made over the past 4 years to build DFCs in Singapore. Nevertheless, the first national survey on dementia found that 3 in 4 people with dementia felt ashamed, lonely, and rejected. 1 in 2 people with dementia cited stigma as the main reason for their shame. Nearly 30% of caregivers felt embarrassed while caring for people with dementia in public. Over half of the respondents knew little about dementia and felt uncomfortable interacting with people with dementia. However, it is encouraging to note that almost 80% of respondents wanted to do more to improve the lives of people with dementia. The study reinforces the need for greater dementia awareness and more dementia education. To conclude, the creation of DFCs requires long-term commitment because DFCs cannot be achieved overnight. Besides, it requires the establishment of a broad network engaging grassroots leaders, businesses, community partners, the general public, volunteers, people with dementia, and the carers to work on dementia-friendly goals and actions. Also, it's necessary to break the cultural taboo of dementia by getting people to talk about dementia. More dementia education should be provided to address the knowledge and skills professionals and non-professional groups need to care for people with dementia. That's the end of my presentation. Thank you.
Hello everyone, welcome to the presentation of Mentality, which studies success factors of dementia-friendly societies. My name is Marjolein Thijssen and I will be presenting with Neil Chatborn. Just first let me introduce you something about Mentality. It's a collaborative project that studies success factors of dementia-friendly initiatives and knows 3 phases. In phase E, as you can read, we focused on the community dementia-friendly initiatives and the outcomes for people with dementia and their caregivers. In phase B, which will be the central part of this presentation, we focused on understanding what matters in developing and sustaining dementia-friendly initiatives and why. And we use a multiple case study. And in phase C, we will be testing and revising the results from work package A and B during a realist evaluation. As I just said, this presentation will focus on the work package B, which was conducted in both the Netherlands and Sheffield. Work package B, the central research question was, what are, according to stakeholders of best practices, the contextual factors, underlying mechanisms, and outcomes that play a role in creating and sustaining dementia-friendly initiatives in their context and why. We selected 4 cases in the Netherlands, Boxtel, Roermond, Haarlemmermeer, and Heerenveen, and 1 case in UK, Sheffield, which will be presented by Neil. The research data that we used were interviews, most of them, participating observations, documentations from reports and websites, and this was done and then discussed during a focus group with the stakeholders who were involved. The next slide will tell you something about the cases in the Netherlands. First, the urban versus rural. You may see some sizes of the cases. The second is the dispersion in the Netherlands. Boxtel was lying in the southeast. Haarlemmermeer is a city in the west of the Netherlands. Heerenveen is a city in the north of the Netherlands. And Roermond is a city in the south of the Netherlands. We also looked at the level of implementation of dementia-friendly initiatives so that the stakeholders had some years of experience to talk by. Data collection, you may see in this overview what was done, and it's good to add the dementia-friendly initiatives that were central during our visit to the sites. In Boxtel, it was an outdoor initiative, gardening and a physical environment that was adapted. In Haarlemmermeer, the friendly initiatives was Alzheimer Café. In Heerenveen, it was a dementia-friendly museum. And in Roermond, there were 3 of them, a dementia-friendly core, a library, and a shared living room. And you may see in this overview the interviews in total we did, the participating observations and where we went, and you also see the documentation that we studied. At last, you can see the focus group and the amount of stakeholders that we visited. I will now say something about the results that we found. We found that in all 4 cases, they were very much busy in building public support for a dementia-friendly community. And important success factors there were the reciprocity among the stakeholders and a focus on others' well-being, doing something for someone else. And that really a big success factor was that gave them a feeling of making a difference, a feeling, but also making something, creating something. A second thing that people were very busy with was the interdisciplinary collaboration during the development and sustainability of those initiatives. And important success factors were having a grip on the collaboration, working from interests, and again, a feeling of making a difference, and that really adding to a feeling of connected. And connected to each other, but also connected to the initiatives. And a third part is every case was very involved in making sure that dementia-friendly initiatives were visited by community residents, people with dementia and carers together. And success factor here was that people had clarity in the overview of dementia-friendly initiatives, that they were able to make a choice from their own interest, and that when visiting and participating the dementia-friendly initiatives, they had a feeling of being respected. I will now illustrate some of those results by a CMO, which explains the context, mechanisms, and outcomes. The first, building public support. You may see here also the interdisciplinary stakeholders. And what I would like to emphasize is the importance in the context of being visible and approachable. That was illustrated by some person with dementia who visited an information meeting, and when they were talking about people with dementia, he stood up and he said, "This is about me," and that changed the whole ambience. But people, I already addressed the mechanisms, and I would like to emphasize the outcomes, because what was really important that people, the outcome of having a positive idea of their own contribution. And that also mattered to the collaboration on a meso level, that people were more willing to collaborate. And that also added to a positive understanding about the importance of dementia-friendly communities in general. And that was illustrated by a quote of some of the members. I understand that little things matter, and I can do that. But that feels nice, and it's not complex. Everyone can do that. A last illustration of the findings is in this slide, the Interdisciplinary Collaboration for Development and Sustainability. And what I would like to emphasize in the context is that the interdisciplinary stakeholders really were involved from a personal interests. They were a personal affinity. Another important success aspect of the context was the transparency in budget and manpower, and that was created by the involvement of also people from different organizations that really could say something about the possibilities in both budget and manpower. And that enabled all people involved in making decisions together. And that really added something about what is said in the mechanisms, feeling connected. The outcomes was fulfillment on a personal level, improvement of initiatives and collaboration, and on a macro level you saw that collaborations were both goal-oriented and people were having much of enjoyment. And I will now hand it over to Neil, who will say something about the findings in Sheffield.
So, led by Kate Radford, we're the UK advisory group at University of Nottingham, and I carried out some field work in Sheffield. We talked to Dementia Action Alliance and attended their meeting, and visited a dementia cafe, interviewing various stakeholders, including people with dementia and care partners in a similar process to just described by Marjolein. So I'll just highlight a couple of similarities and differences to the Dutch work already described. A key thing that came up from the Sheffield work was the importance of relationships within the network, and important role of advocates within the community. This might be trainers or coordinators. And a key quote here is that that there were pre-existing relationships that enabled these activities to develop, and that developed the resources within the community. The other side of that coin, if you like, is the community ownership of this issue. And the context here is that community organisations such as the church got involved in initiatives. And another quote here is about a volunteer who wrote a dementia-friendly booklet that went along with songs that they played on the ukulele. That really shows that people are investing their time and effort into these initiatives, and that really helps to tackle stigma in the community. So to summarise some of these points, despite differences in context between England and Netherlands, we found that there are commonalities in dementia-friendly initiatives, and it's an important role of advocates in the community and building trust in communities. From this, we're developing a framework to test these theories, and we'll be implementing these in sites in Netherlands. Thanks very much for your attention.
Right, thank you very much. So this is Rich Cheston again, coming back. Whoops. Right. Hello. Well, thank you all for those presentations. We have 8 minutes, I think, for some questions. We've had some questions sent in already. I don't know if I can ask Haley to bring everybody back. We're still waiting for Steph and Sabrina. So one of the questions that people asked, and I know this is a very complex area, but perhaps would there be, it's fascinating listening to what was happening in different countries, and there's some of the similarities. if there was one thing that you had to identify, or one thing, hello Sabrina, hi, came out of your studies about an outcome, that if we were to come back in 10 years' time, what would that one outcome be? I know that's probably a very difficult thing to focus down on one, but what one thing would you suggest that the aim of these of dementia-friendly communities was to achieve? Neil.
Thanks, Rick. I think people with dementia and care partners really getting involved in the development of opportunities in the community, whether that's at a local level, just in shaping their opportunities in the Dementia Cafe or other activities, or whether it's more strategically in terms of a kind of city strategy or other strategic work. So I think that's really important from a human rights perspective.
Thank you. Steph?
And also the issue about normalization, really. I mean, this is a long route to take to get there, but I think ultimately that should be the aim, that you almost don't need to talk about it anymore, that it is something that the inclusivity becomes something that is taken for granted.
Lovely, thank you. Sabrina, what's it like in Singapore? What would you aim for? I think you're still muted, Sabrina.
Yeah, okay, I'm back.
So
I think one of the issue is how to make this conversation to talk about dementia, make it very comfortable, not only between people with dementia and a carer, but I think it's the younger generation. Okay, because I think when I teach the courses on healthy aging, and then younger generation cannot relate to dementia, okay, unless they have family members, okay, that have dementia, and they think that is something so far away. But I think because in the context of Singapore, lots of people will live longer, okay, when you look at the longevity trend. So I think it's something that we have to be psychologically prepared, because I think they still think that, obviously some of the students, okay, they think that, wow, it's too soon, okay, too early, okay, to talk about it. So that's why I think younger generation, but how to make them, okay, whether there are more channels for them to talk about this topic, or having more simulation experience. So I think this is something that I think the society as a whole can think about it. Yeah.
thank you. And Marjolein?
I think everyone said really lovely things. I can only emphasize. What I would like to note sometimes is that dementia is a shared responsibility, not only for people who are affected with it, but also for us as community. And I think that also mentioned by Neil and Stephanie and Sabrina.
Yeah, I was very fascinated you were saying about the mutuality, that people appreciating a chance to give to people, which is really lovely. One other question that we've had sent in, and people, understandably, I imagine all your data collection occurred before the lockdown and before the pandemic. I just wondered if anyone had any thoughts really about how the pandemic might be affecting the dementia-friendly communities in your different countries. Sabrina.
So in the context of Singapore, because we experienced the circuit breaker, so it means that we as under the legislation, we are supposed to stay at our place, residence, okay, unless we go out to buy groceries or do exercise or seek medical help. But I think that is some situation where people with dementia, so they will go out, okay, and just like wandering, okay, and because of the legislation, we are also have to wear face masks when we go out. But I think people with dementia sometimes they do not wear face masks and create a kind of misunderstanding. So when people on the street, when they look at them, but I think in the context of Singapore, so in Singapore we have Alzheimer's Disease Association. So in order to erase this kind of misunderstanding, because on the street we have safe distancing ambassador, so to do something just like enforcement. So I think that's one community is to issue some ADA memo, so to indicate that this is a person with dementia, so that when social distancing ambassador, so when they see someone so that does not wear face mask, at least they do not just like approach them, and then so in a way that don't make people with dementia that feel very anxious, when someone say that, you do not wear face mask, something like that. So I think COVID-19 is that because we, most of us stay at home, but I think we still, because I also download the Dementia Friend app, so during the circuit breaker period, we also receive that kind of alert, that so there are missing person with dementia. So I think the technology thing in terms of COVID, I think did help, because I think that I think we the government have used lots of resources to, for example, contact tracing, and I think the government have deployed lots of enforcement officer, police officer to do the contact tracing, lots of things. So I think we really need the help of the community as a whole to help, when there is a need. So make use of community resources, because I think unlike maybe Western model, in Singapore we need to as a ground of movement, dementia. So we try to make use of what we have, community resources. So in order to achieve these dementia friendly community, is to reach out, let more people to provide help.
Lovely, thank you, Sabrina. I'm very sorry. I appreciate we've also had one quick question before we go maybe to some of the UK-based ones. We've had a question sent in from Olaf, who asked, has there been any work on a dementia app in the UK? I'm not aware of any. I don't know if anybody else is. Very quickly, because we're going to have to finish, but anybody want to add on that?
Yeah, colleagues at Institute of Mental Health in Nottingham have been working on a European network that have been developing a lot of apps for various purposes, not related to COVID directly, but some of these apps help people with dementia navigate various different apps. So as a way of enabling people to access these kind of technologies.
I've had a message from our organisers that we can run over, so one more quick question. Patricia asks, what do you think are the main challenges to being able to align dementia-friendly communities with local government agendas? Again, very quickly, because I'm aware people are going to have to finish. It's nice to have the interaction element. Anybody want to add on that? Main challenges to being able to align dementia-friendly communities with government agendas? Marjolein?
Yeah, I would like to give it a try. What I really think that the most important challenge is to see people with dementia as experts. That's also something you see now with the COVID agenda, that a lot of policies are made by experts, which is really important. But the consequences and what it means for people is that now a lot of emphasis is based on care. And I think we should, the challenge is to look more closely to what matters really for those people affected by dementia, and to really listen to them. And I think that really listening and taking it really seriously and take it into policy papers, I think that's the main challenge also for the local government. Yeah.
Thank you very much. Anybody else want to quickly add on that? Steph?
Well, just on the issue of resources and priorities, really, because especially at the moment, we know what it's like. It's probably really difficult to prioritize this, especially from a statutory sector and local authority point of view. and to find the time for it really, and the energy among everything else that is going on.
Well, thank you. And I'm very aware of time moving on, so I think we do need to wrap up at this point. I'd like to thank all our presenters for, we were saying before, it is rather nerve-wracking to do all of this. Thank you very much for taking your time and presenting these fascinating studies. I look forward to seeing more things in reading results properly later on when you publish. So thank you very much. And I'd like you, I don't know whether Haley or Gary, you want to come back and conclude, but if not, I'd like just to thank everybody for attending and to wish you all well in these difficult, challenging times. Goodbye.
Okay, stay healthy.
Thank you.
Bye.